Speaking on advocacy and your passion for just being involved and helping your community, what's changing in the African health trends, and why should we care about cardiovascular disease?
Yes, please. We should have opened with that. Okay. So what is changing is the we're seeing an early onset and fast progression in cardiovascular diseases. Another word I can't say properly because of my stutter. I have to say it very fast, or I need to breathe as I say the word. So cardiovascular diseases, I struggle that way. I usually just go for CVDs. Okay. So early onset and fast progression. It is happening. For example, if you look at obesity diabetes, it is happening as early as in our teenage years. It's a study by Professor I love so much, won't say their name because they're in a different university, but they're focusing on teenagers and what's happening with CVDs in teenagers. So it's happening earlier, it's happening faster, which means we've got what we call premature mortality. So people are dying earlier than we expect them. I almost went into public health just for surveillance and for protection of, because I also find it very interesting.
Yeah.
So that's also happening within our culture, within where we are. A big contributor to it is westernization, modernization. I said this in a radio interview that I read a lot about westernization, urbanization, and its effects on CVDs, NCDs, and just life outcomes. I read so much about it that when I lived in Joburg, I'd forgotten about it. Here's how. You read so much about something because you're thinking I heard. It's not where I am, because I was still not in Johannesburg. I was in the rural areas reading about it, that, okay, urbanization, westernization, lack of physical activity, eating processed foods, high sugar intake, alcohol abuse, smoking. I saw those as city lifestyle, because even the papers I read, especially around CVDs, hypertension, whatever, I will say that is the biggest contributor. And then I came to Johannesburg, and I was writing my master's, and I was writing the effect of urbanization. And I was like, wait a minute, I'm now living in it. So actually, I just went out and observed it. Fine. But westernization still plays a role.
Yeah.
But now someone asks, if you're saying that, Edgar, are you saying then in the communities, in the villages, are we still having low rates and prevalences of NCDs, CVDs? No, we are not. We're also having increasing rates there. Because now westernization is not just limited to Johannesburg, Cape Town, whatever. We are bringing it back to our villages. What do I mean? When I now go home, after seeing how we live here, how we eat here, what we do, I want to introduce that in my village, to my family. So I'm bringing the food we eat, I'm treating our food practices, our behavior, I'm bringing it in the villages. So now I'm exposing them to this lifestyle and its risks. So they also develop hypertension early, diabetes early, obesity early. What's important? What do we need to? Awareness is key. Another thing I read about many years ago, before I came to Johannesburg, about low prevalences and low awareness of hypertension and other NCDs. It still exists, unfortunately. People are not aware that they may have developed hypertension, or they may have a diabetes or some form of hidden NCD like chronic kidney disease. Obesity, we see it. But other things are hidden. So low prevalence is still an issue. So because of low prevalence, then it contributes to the progression. It contributes to the premature death that we see. And if we go into the grand scheme of things, premature deaths affect the economy because it is the working class. Ages from 24 to 45, almost 50, are the ones that are experiencing this premature death. That is the working class.
Yeah.
Because some people will retire at 50, 55, and obviously 60 is the retirement age. But it is the working class that we're losing to these diseases. So again, that affects our economic growth and other things. What can you do in the communities? Again, smartphones. We can take advantage of our smartphones. It really doesn't take much to search what is hypertension, what is diabetes, what is obesity, and other NCDs or CVDs. How do I prevent this? If you don't have a phone, just worry about your life in a good way. Just say, am I eating well? Am I exercising? Am I taking care of myself? Am I on the goal to live until I'm 80 or 90? God, I want to live until I'm 90. That's my goal. I want to get to 90. Apparently, 70 years was what we were given to live. We were given to live up until 70. Beyond that, it's a bonus. They want 20 years of bonus. So how I live matters. There's obviously other things you can't predict, like cancer, accidents, other things that you can't predict. But if you just try and live right, People are also afraid of hospitals or clinics.
Yeah.
Just to walk in a clinic and just get your blood pressure measured, get your finger pricked for that glucose test. People are afraid of that. I did a radio interview recently. I won't say who they are, but after that interview, someone sent me a voice and said, "No, I won't go there because they're going to give me diseases I don't have." We can't give you what you don't have. We're just going to measure your blood pressure, measure your blood glucose. If indeed both of them are high, they are high. So there's also this notion that hospitals or doctors give people things they do not have. If you watch medical programs, there's cases where people, misdiagnose people for cancer so they can, milk money out of them. We are not there yet. But just a normal clinic, measure your blood pressure. They will tell you that, "Hi, Edgar, it's a bit high. Watch what you eat. Work out a bit more and do this." It's 5 minutes. But on that note, there's also something called white coat hypertension. You should know that.
White coat hypertension.
Yes.
Yeah.
So it's the anxiety you get by visiting a hospital. So because of that, your blood pressure goes up. So when they measure it in the hospital, it shows that you're hypertensive. Once you leave the hospital, a few minutes later or a few hours later, if I measure your blood pressure wherever we are at the park at your home, it's lower. I think maybe that's what they say. "You see, I don't have hypertension because the nurse said I have it, but you said I don't have it." No. There's something called white coat hypertension. You're getting it because of the anxiety of where you are. So you may not have hypertension, but in that space, I thought you had. That's why my master's and PhD used what we call 24-hour blood pressure monitoring. So I measure your BP over 24 hours so I can see when it goes up, when it goes down. It also gives me an average blood pressure. So I can say, actually, you don't have hypertension. You've got white coat hypertension because of the setting. There's also masked hypertension. Now, that's a bit more dangerous. Masked hypertension happens that by calling it masked, we're saying it's covered. You don't see it. So you come to the hospital, clinic, wherever, we measure blood pressure, everything's well. When you living your life during the day or even at night, your blood pressure is consistently high. It's masked hypertension. How can we pick it up? 24-hour monitoring. You can see where it is almost up. There's another one called nocturnal hypertension at night. Even the one at night has got different elements. The one I did for my PhD was called isolated nocturnal hypertension. It just meant during the day you are fine. You can come to the clinic, we measure you fine, 120, 117, whatever it is, you're fine. You go home, you sleep. Instead of your blood pressure going down, yours go up. So, but these things, we pick them up as more and more people go and get tested, go and get measured. Right now, from May up until the end of August, is hypertension awareness. There's May measurement month. So usually it's supposed to be May, but they've extended it from May to end of August. People are going to be setting up stations at malls, at complexes, at sports centers, just to measure your blood pressure and just check, are you well? I say to everybody, take advantage of those things. Go get your blood pressure measured. Within vets, we've got those initiatives where I think the STEPS program also does that, where they set up in our foyer. They also go to main campus. For that week, they measure our blood pressure, our cholesterol, our glucose. They even do HIV testing. Take advantage of those things.